Have you ever noticed subtle changes in the way you or a loved one moves, perhaps a little more difficulty with everyday tasks that used to be easy? Sometimes, these changes are just a normal part of life, but other times, they can be important signals pointing to an underlying condition. When it comes to muscle weakness, knowing what to look for can make a real difference in seeking timely support. The muscle weakness signs that can point to muscular dystrophy typically involve progressive weakness and wasting in specific muscle groups, often leading to challenges with movement, balance, and coordination. These signs vary depending on the type of muscular dystrophy, but generally progress over time, making once simple actions more difficult. This progressive muscle weakness occurs because muscular dystrophies are a group of genetic conditions that cause muscle fibers to gradually break down and be replaced by fatty and fibrous tissue. Each type of muscular dystrophy is linked to specific genetic mutations that disrupt the production of essential proteins needed for healthy muscle function. For example, Duchenne and Becker muscular dystrophies are caused by mutations in the dystrophin gene, which is critical for maintaining muscle fiber integrity. Without sufficient dystrophin, muscles become fragile and prone to damage with normal use, leading to weakness that usually starts in the proximal muscles, those closest to the body's center, like the hips and shoulders. Recognizing these patterns of weakness is key. If you are observing potential signs, pay attention to whether the weakness affects both sides of the body symmetrically. Look for difficulties climbing stairs, standing up from a sitting position, or lifting objects overhead. For children, a common early sign of Duchenne muscular dystrophy is the Gowers maneuver, where they use their hands to walk up, their legs to stand. Notice if there is frequent tripping or falling, or a waddling gait. These observations provide valuable information for healthcare professionals. An important concept in understanding these signs is the difference between proximal and distal weakness. While Duchenne and Becker muscular dystrophies often start with proximal weakness, conditions like myotonic dystrophy typically begin with distal weakness, affecting muscles further from the body's core, such as those in the hands, feet, and face. The presence of muscle contractures, which are shortenings of muscles or tendons that lead to joint stiffness, and muscle hypertrophy, where calf muscles might appear unusually large due to the replacement of healthy tissue with fat and connective tissue, are also important indicators to note. These specific patterns help doctors narrow down the possible diagnoses. By understanding these distinctive signs of muscle weakness, you can better communicate your observations to a doctor, ensuring a more focused and efficient diagnostic process. Early recognition of these patterns can lead to earlier intervention, which is often crucial for managing symptoms and maintaining the best possible quality of life.